Thank you so much for taking the time to view this presentation, which is part of Office Practicum's Pediatric Success Series. I'm Sue Kressly, the Medical Director for OP, and the topic of this presentation is Rethinking Your Patient Workflow with Social Distancing in Mind. Let's get started. So if your office runs like mine has for the past several years, you are probably thinking you had a well-oiled machine. And then came COVID-19 and social distancing, and everything we had worked so hard to optimize got thrown out the window. Well, with disruptions and challenges come the chance for innovation. Today, we will be looking at changes many practices are making now to their scheduling and patient workflow, and how best we can innovate for future success. Our agenda for this presentation will be to explore what patient scheduling can and should look like, to discuss the role for telehealth, rethinking your patient journey through your office, review pre-visit patient tasks and their vital importance in your socially distanced workflow, identify strategies for making everyone feel safe in your office, your patients, families, and your office team, and then take a look at creating a marketing plan to tell your community about your awesome practice innovations. Our patient experiences in our office start with scheduling. How do you meet your patients' needs and support your business? You must consider the physical space of your office, how best to incorporate well and sick care, and for the foreseeable future, decisions must also reflect your PPE supplies. And as always, you must consider every choice you make and how it impacts your business. As the mantra of the AAP section on administration and practice management goes, no margin, no mission. Without a sustainable business model, you won't be there to support your families and community. We all come up with great ideas, but first we must ground them in the reality of the present and of our foreseeable future. The truth of the matter is that we are likely to see less in-person visits per provider per hour than we could when we jam-packed our waiting room and quickly moved from patient to patient and room to room. In order to follow social distancing safe best practices, we need to keep patients as distant from each other as possible, and that can be in both time and physical space. For everyone's safety, we can no longer, in good conscience, intermingle sick and well visits. When we consider rebuilding our schedules, there are some ideas we should give thought to, including having staggered start and stop times and even staggered lunch times so that we can pace our patient flow a little slower and perhaps extend the hours of the day that we are available. And this includes both in-person and virtual availability. Speaking of telehealth, how do we incorporate those hours into our office workflow? Do we rotate an hour of telehealth throughout your day and stagger by provider? This does have the advantage of having time in the schedule for each provider to continue to do virtual mental health follow-ups and essentially have some same-day walk-in virtual visits. Do you do 2 in-person visits with a telehealth in between to allow for pacing of the foot traffic through your office? If you do so, do you have your office staff make sure the patient is waiting for you in the virtual waiting room so you can improve the efficiency of your workflow? Do you use a texting or phone curbside check-in and assign patients directly to a room as they arrive? And since it may be necessary to pace your in-person visits a little further apart, do you use that patient turnover time to have your providers directly answer portal messages or schedule phone callbacks so that those touch points can also be billed for? Traditionally, office team members provide many of those services, but now that they are recognized, billed for, and paid, if we are providing care advice, it's time to make sure that we are paid for all the work that we do. You might also schedule some follow-up telehealth brief check-ins with your patients during the time in between in-person office visits. Let's talk about social distancing and spacing out the patient foot traffic inside your office. Decisions about how to tackle this must consider both physical space and appointment time spacing. Is it time to consider your waiting room a thing of the past completely? Do you, from this day forward, repurpose your waiting room? Or do you set it up for a self-check-in kiosk as you redesign for the future? Part of it depends whether you're in an area with a parking lot or in an urban area where nobody arrives by car. Do you have the physical room to separate your sick and well rooms and maybe even support different entrances? Do you have multiple close by locations and decide that you will rotate by days of the week which is the sick office, or make one permanently the sick office? If you have been using wave scheduling to maximize efficiency, it's likely that you should adapt this in some way. If you have plenty of exam rooms, you may not need to adjust the number of patients you are seeing if you can room them as soon as they come to the office. But you may want to equip each exam room with everything you need for a visit, including a scale, a stadiometer, and a printer. Regardless of the changes you make, take an honest look at how realistically you were scheduling patients prior to COVID. This includes start times in the office. Were your providers in their seats with stethoscopes poised to begin seeing the first patient as soon as the patient was ready? If not, this is the time to tackle creating a culture of respect and accountability regarding everyone's time. Everyone's time is important, and now more than ever, running on time keeps your patients and staff safer. If you were always running behind, now is the time to fix that. Not every appointment in pediatrics takes 15 minutes. Do a time motion study of how long a visit actually takes, not how long you want it to take. Make allowances for a teen checkup, which takes longer than a school-age child. Make allowances for the complex patients that always take longer, or the mom who comes with 2 pages of extra questions. Make extra time for headaches and chronic abdominal pain and fatigue, which we know takes extra time. This is also the perfect time to start role-playing, ending an appointment appropriately. If the appointment is taking too long and the issue is not critical, empower the providers to say, "I'd love to continue this conversation, but if we're going to keep all of our patients safe and not get backed up, let's wrap this up and continue the conversation with some portal messaging, or can we schedule a virtual telehealth visit to make sure all of your concerns are addressed?" No matter what, it's clear that well visits will be forever the cornerstone and lifeblood of pediatric practice. Fine-tune your well visit protocols and dedicate staff to keep the recalls going. As you may have variability in sick volume, well visits are predictable. They pay well, and if you really work at this, you can make up the lost income from sick volume by getting pay-for-performance bonus dollars from many of your payers, or you can use your high quality to negotiate better fees. Some practices by default have scheduled every sick person as an in-person visit. This may no longer be feasible or even the right thing to do. And patients who are hesitant to come in may be willing to be cared for virtually or via phone call or a portal messaging. Almost every practice I have talked to within the last few months has decided that in order to keep patients safe, the same provider can't float back and forth between sick and well care. Most of us feel that once you go sick, you don't go back to well for the day. How does that change your patient scheduling? That may mean that patients no longer have a choice who they want to see for an acute illness, but if that's the best way to keep patients safe and you explain it, they are likely to accept it. Many of us have been seeing well in the morning and sick in the afternoon, but is it really safe to make all sick patients wait until the afternoon? Likely not for a child who is having trouble breathing or has a febrile seizure. This may also extend into your evening hours or extended hours. Do you have someone do well visits to accommodate 2 working parents and someone else do a few hours of sick in the evening, or someone else do telehealth sick? So let's talk truth about telehealth. There is no way that telehealth is going away. If your practice doesn't develop a telehealth strategy, your patients will find another way to accomplish their needs for access. They will find another practice that has telehealth, or they'll utilize direct-to-consumer telehealth services, or they'll go to urgent care and retail-based clinics instead of your medical home. The telehealth genie is out of the bottle, and she isn't going back. Our families will demand it, and increasingly so when they are no longer working from home and their kids are back at school and daycare. Parents who are trying to hold on to jobs cannot afford to miss time away from work, and kids have already lost an incredible amount of educational instruction time. Especially the kids with learning issues, they cannot afford to miss school to come to an office appointment in the middle of the day and the travel time that goes with it. It's not an efficient use of family time, and often healthcare is not their first priority if they're trying to hold down a job or even two. While FaceTime and other non-HIPAA compliant telehealth solutions were permissible during the pandemic, they will not be for the long term. I encourage you to find yourself a HIPAA compliant telehealth solution that works for your practice and get it implemented and integrated. Getting paid for telehealth services is a critical part of the role virtual visits will play in our practice. Don't wait for someone else to solve this problem for you. Get involved in advocacy at your state level, working with your state AEP chapter or pediatric council. Many of these decisions involve passing laws regarding payment parity. It is also important to remember that 50% of what appears to be commercially insured plans are actually employer-sponsored plans that are passed through the commercial insurer. So get to know the larger companies in your area and speak with them about making sure they cover telehealth connections to your medical home. Most importantly, if you're having trouble with a specific payer, get your families to help. Create a letter that they can download and send to their payer, or give them some talking points and ask them to call. They are the ones who have the most to lose if they lose access to care via telehealth if the payment goes away. So let's talk about some telehealth musts. First, in the realm of advocacy, we must permanently remove the constraints around the originating and distance sites. We should extend our medical home to the patients wherever location they may be, and we must be able to extend and protect our workforce by allowing our providers to give care at their home or other sites outside our office. As a practice, you must decide what your telehealth offering will look like, not if, but how. Will you have telehealth visits only be scheduled in advance? Will you make telehealth visits available all day long to increase access? Or will you do a combination of both? Perhaps you'll make telehealth virtual walk-in hours in the morning and after school and scheduled appointments during the day. If payers take away payment and it becomes a non-covered service, will you charge the patient, and if so, how much? It is certain that direct-to-consumer providers of telehealth do so. The only question is how much you will charge, and is your patient population in a position to pay it? Remember, if the insurance company pays you, but you don't think it's enough, you can't balance bill the patient. Then it's time to renegotiate with the payer and show them your true value-based care, which includes telehealth options. Perhaps they will give you a fixed amount of dollars per member per month just to provide telehealth service to their insureds. It doesn't matter how you get paid, just that you do and that the numbers make sense. So let's get to what I think is the most important part of this presentation, the patient journey. Do not shortcut this difficult but very important work. This means looking at an entire experience of patient visits from the patient and family viewpoint. So step one, outline what a patient journey looked like prior to COVID. And I literally mean write down all of the steps, the possibility, and the options that were available for any patient. Step two, do the same thing for what it looks like now. Step three, build your own innovative patient journey for the future. And in order to do this right, it will take time, effort, and a team dedicated to do this well and to keep it going so you can continuously adapt and improve. Ideally, create and empower an innovation team and be sure to include a patient and family representative. You do not want to assume what this looks like from a patient's perspective. You want to know from them what it's like to be a patient in your office and what families need. Ask them, incorporate their ideas. So where does the visit start? It actually starts when an appointment is made. If we're going to keep everyone safe, you need to consider which patients actually receive care and in what format, and who's going to be responsible for making those decisions. There is no right answer here, but you must thoughtfully consider all of the options. If you bring everyone in, can you do it safely? If you triage everyone before an appointment, do you have the right team to do that? If you allow self-scheduling, how do you keep patients safe? Appointment reminders are also part of the journey. If you are instructing patients to bring only one parent and everyone over two must wear a mask, how does that get communicated? If you are using two entrances or two different offices, how does the family know where to come? What if a well patient wakes up the day of their appointment and they're sick? Do you want them to come? How will they know what to do? Where and when does check-in happen? Do you have a parking lot attendant that screens everyone for sick symptoms and temperature taking before they hit the front door at all? Can you use technology to have patients pay their copay online and text them directions on what room to proceed to when they arrive at your office? Do you have a map of your office with exam rooms on your website to refer to? Do you create a greeter that takes patients directly to the exam room and swipes their credit card in the exam room where you've added a credit card swiper to be able to do so? Has the waiting room, even those divided into sick and well, seen its last days? Is it time to repurpose your waiting room? If so, with what? Do you create self-check-in kiosks with plexiglass dividers? If so, you're going to need someone to clean them down between patients so that they feel confident using them. For checkout, do you accomplish that also in the exam room, scheduling the next visit? And again, if there's a patient balance, using a credit card on file policy to help with patient payment responsibilities. Handoffs in medicine inherently allow for something to get missed, allow for stops and starts in the process, where everyone is waiting for the next person to be ready to accept the patient in the care continuum. It can create a culture where nobody is accountable, and the answer can be often, it's not my problem, if we're backed up in the back or at the next stage. As we add in social distancing, reducing the number of people the patient comes in contact with also increases everyone's safety. This is the perfect time to totally rethink your office roles and responsibilities and what happens inside your office when patients arrive. If you are moving check-in to the phone or electronically, or you have a clinical team members escort patients directly to the room, is it time to repurpose that front desk staff to be virtual assistants, helping families connect to care, or do they become the recall and well visit scheduling team? Do you have a clinical care concierge that stays with the patient the entire visit journey? Think of the connections that creates for families and for the staff, who really now has the opportunity to make a difference in that experience. It is time to take your entire workflow, disassemble the Lego blocks, and recreate it and redefine every role within your practice. Optimizing the office experience and time spent also depends on getting pre-visit work accomplished. This includes the office team getting ER records, noticing care gaps that need to be closed while the patients are in front of you, noticing who didn't complete surveys, etc. The office medical home huddle has gained even more importance, and many office teams are now huddling several times per day. In the morning prior to patients, midday to see how things are going, and an end of the day wrap up. This huddle time is time worth spending. The patients being prepared for their visits and completing information online in advance of the visit really decreases the time they are spending in the office occupying an exam room. If you get this right, you can see more patients because room turnover happens more quickly. Many practices struggle with getting families to do work prior to the visit. Seize this opportunity. Everyone is aware that things need to change and will continue to do so. If you explain the why to parents, we don't want you to have to spend unnecessary time completing information in our office that you can do in your own time in advance. We don't want you to have to use a shared device to fill out surveys. If you do this work in advance of the visit, you have more time to address your concerns during the visit. Parents and families are more tolerant at this moment while you work out the kinks. They have been hanging in there with us through telehealth visits, and they get we are trying to deliver good care as safely as possible. Make sure as you redesign this workflow that you include everyone in your office team that this impacts, including those who may have to call the family the night before if your huddle reveals they didn't do their surveys in advance. Once again, don't assume what families need. Ask them. Ask them also what kind of messages would motivate them to do this work. Your families and your office team needs to know this. Safety must be your #1 priority. You must actually believe that safety is important, not just give it lip service, but believe it. Walk through your office and see if there are places you can improve. Then advertise it. Your families will be more confident coming to your office in the future months if they know what you are doing and take it seriously. You must also empower everyone. That includes patients, families, and anyone on your office team. If there is ever a question about patient safety, intervene to fix it or escalate it to a supervisor so it can be addressed quickly. Your commitment to safety is both for your families and for your practice team. Let everyone know what you are doing through website and social media updates. Make policies regarding masks, visitors, number of accompanying parents visible to everyone everywhere. Make cleaning visible to everyone. Do you post your cleaning protocols on the back of your exam room door that says, "Here's what we have done to make you safe in this room while you're waiting"? Do you have a sign on the door that as you enter the room, they know they are entering a clean room and you flip it to occupied as you enter? Do you have hand sanitizer available for everyone but safe from toddler curiosity? Not only do you have to talk about it, but you have to live it. Do you now have a safety officer? If you don't, it may be the time to appoint one. Do you have signs about your commitment to safety and encourage everyone? If you see something, say something, so you continually work to better and instill in your families that your visiting your office is a safe experience. Okay, now you've completely redesigned how your patient flow works in your office, and it's time to tell the world about your awesomeness. Don't make these changes and keep them invisible. Parents are looking for reassurance and confidence. Have a multimedia strategy to tell your community what you are doing and why they should come to see you. Make the patient experience the focus of your redesign and tell them you built this with them at the center. Since people consume information in different ways, make sure there is no wrong door to the same great information. In-office messaging, your website, social media, practice newsletters, create a practice YouTube channel and tell them periodically. If you really want them to get excited, make a patient journey video so they can see your innovations in action and push it out there as many means as you can, including emailing all your families with a link to it on your website. And then work to become the trusted source of great information in your community. Offer to do virtual talks for daycares, schools, and other community groups. Do Facebook Live chats to increase your audience and attract new patients. Hold prenatal visits virtually, where you give prospective patients a virtual tour of your office, as well as walking them through your website and demonstrating the value of your patient portal and telehealth offerings. Thanks so much for your time and attention. Ready for innovating your practice to position yourself for future long-term success? You better believe it. You got this.